Well, Dr. Lipari, thank you so much for sharing with our viewers just all the different aspects of infertility and how we do things a little bit different here. Could you explain today a little bit about what the male partner could expect with coming in to see us?
Well, Yvonne, I'm so glad you asked that question because it is something that is extremely common. And we try to encourage couples to come in together because a lot of times we find things on both sides. And there's actually, some of the literature highlights the fact that male factor at times is probably one of the more common things that we find. We even see about 40% of the time there's a contributing male problem. So these are things that when we're trying to optimize fertility on the female side and we can do it on the male side, sometimes that's going to kind of equal, a baby, and that's kind of what our approach is. So for a guy that comes in where he and his partner have been trying for a long time and they haven't been successful, we typically want to do a semen analysis. And the standard of care is actually 2 semen analyses. And the reason why that is because it actually takes 70 days to make sperm, believe it or not. So sometimes a semen analysis can reflect things that were happening kind of months ago. And when we think about that, if a guy had a bad head cold or was going through significant stress or something was going on, we could see some abnormalities in the sperm that are not persistent. So if we have 2 semen analyses, one looks not so good and one looks normal, it probably is just in relation to what was going on in his life at that time. The other thing is that male factor or problems with sperm are usually very treatable. So, one of the more common things that we find is a problem with hormones. And there are many men out there that are young and healthy and have borderline or low testosterone levels. And those levels or the levels of testosterone are absolutely essential for normal sperm production. Now, this doesn't mean that guys can just go out and take testosterone and all of a sudden their sperm improves, because actually when they do that, it's almost like a guy taking a birth control pill. So when guys are taking testosterone, whether it's their primary has them on it or they're using it for bodybuilding, what it does is it's going to suppress the brain's ability to stimulate the testes, and sperm counts are going to get worse. But fear not, there are ways to kind of get the sperm to kind of recover. Most of the time, this is a reversible thing where we would evaluate one, why is the testosterone low? So that could be the body telling us that there's some issue that we really need to figure out. Medical problems can cause the testosterone to be low. Obstructive sleep apnea, where guys are snoring, it could be low. Guys that are a little overweight, it could be low. And then there are a whole host of other factors that we look for. But basically, there's kind of a twofold objective when we find that. One, we can make the guy feel a lot better. So if his testosterone is normalized when it was low, mood should improve, sex drive improves, energy, reduced fatigue. And secondly, we're able to improve the sperm at the same time. So it's kind of a win-win situation when we find somebody that has low T that we can fix, and then also that's been trying to have a baby for a while.
That's great.